Effective today, my administration is officially declaring the opioid crisis a national public health emergency under federal law, and why I am directing all executive agencies to use every appropriate emergency authority to fight the opioid crisis. This marks a critical step in confronting the extraordinary challenge that we face. As part of this emergency response, we will announce a new policy to overcome a restrictive 1970s era rule that prevents states from providing care at certain treatment facilities with more than 16 beds for those suffering from drug addiction. We're working with doctors and medical professionals to implement best practices for safe opioid prescribing. And we will do something very, very special. We are requiring federally employed prescribers to receive, finally, special training. The U.S. Postal Service and the Department of Homeland Security are strengthening the inspection of packages coming into our country to hold back the flood of cheap and deadly fentanyl, a synthetic opioid manufactured in China and 50 times stronger than heroin. And in 2 weeks, I will be in China with President Xi, and I will mention this as a top priority. And he will do something about it. I will be pushing the concept of non-addictive painkillers very, very hard. We have to come up with that solution. We give away billions and billions of dollars a year, and we're going to be spending lots of money on coming up with a non-addictive solution. For too long, dangerous criminal cartels have been allowed to infiltrate and spread throughout our nation. An astonishing 90% of the heroin in America comes from south of the border, where we will be building a wall which will greatly help in this problem. Every person who buys illicit drugs here in America should know that they are risking their futures, their families, and even their lives. And every American should know that if they purchase illegal drugs, they are helping to finance some of the most violent, cruel, and ruthless organizations anywhere in the world. Illegal drug use is not a victimless crime. There is nothing admirable, positive, or socially desirable about it. There is nothing desirable about drugs. They're bad.